Dr. Roshan Koshy Jacob, Consultant Medical Oncologist from American Oncology Institute, Nagpur. Today, as a part of the Pancreatic Cancer Awareness program, I will be talking a few points about pancreatic cancer. Now, as you may all know, pancreas is a gland that is located deep in the abdomen between the stomach and the spine. The main function of the pancreatic gland is to make enzymes that help in the digestion and also the hormones that help in controlling the blood sugar levels. Now, coming to pancreatic cancer is a highly lethal disease. It's so much so that the mortality is almost close to the incidence. It currently ranks 12th in the most common cancers and has a notorious distinction of being the fourth leading cause of cancer related death. This high mortality is one of the reasons why multiple studies are ongoing in pancreatic cancer. Factors that may increase the risk of pancreatic cancer include smoking, diabetes, chronic pancreatitis, family history of genetic syndromes, family history of pancreatic cancer, obesity, older age. Now, coming to the clinical features, most of the patients of pancreatic cancer remain asymptomatic until the disease reaches an advanced stage. Typical presenting features include abdominal pain, back pain, obstructive jaundice, weight loss. Weight loss can arise from either anorexia, cancer cachexia, or maldigestion. Occasionally, patients can present with pancreatitis, and some patients have gastric outlet obstruction syndrome who present with nausea and vomiting. Deep and superficial venous thrombosis is also a common presenting feature of pancreatic cancer. As such, there is no standard program for screening patients at high risk for pancreatic cancer. The endoscopic ultrasonography and endoscopic ultrasonography guided FNAC offers a high diagnostic ability for pancreatic cancer. Despite the developments in the detection and management of pancreatic cancer, only 4% of the patients will live up to 5 years after diagnosis. Patients with pancreatic cancer are best managed by a multidisciplinary team, which includes oncologists, surgeons, radiologists, gastroenterologists, radiation oncologists, pathologists, pain management experts, social workers, palliative care experts. Pancreatic cancer is a heterogeneous disease at molecular, pathological, and clinical level. So, from each patient to patient, this may vary. The patient's response to treatment outcome to the treatment may depend on many factors, including the biology of the cancer, the performance status, and the pattern of disease progression. Patients with pancreatic cancer often are divided into 4 categories, which includes resectable, borderline resectable, locally advanced, and metastatic. The patient's condition is an important factor when we are considering for any treatment. Surgical resection is the only chance of cure, and advancement in the adjuvant chemotherapy have improved the long-term outcomes in these patients. Chemotherapy in pancreatic cancer is evolving with the results from newer trials adding to the changes in the recommendations. The risk of developing pancreatic cancer may be lowered by stopping to smoke, maintaining a healthy weight, choosing a healthy diet, proper exercise, and early screening in case there is a family history of pancreatic cancer.